My questions are two. Is there any explanation that despite the fact that that thing had been resolved, that, in Orthodox medicine, the woman whose husband is healthy and sexually active, is there any reason why the woman can never be pregnant? That's apart from whatever is wrong with her has been resolved. And maybe we are talking about a 28-year-old. Number two is that a woman who, for example, had miscarriage earlier, or they have done, what is that thing that they do? That the name for abortion, but I don't want to use it. Evacuation or something. You get it. They have done it for the woman. And it is complained that that thing is not completely done. They still did it. What could have happened to the woman that after that she stopped menstruating? You understand? And she find it difficult to menstruate. Then number three, is it possible for a woman who is not menstruating to be pregnant? Then lastly, can a woman at menopause ever be pregnant? The last question, I'm asking the opinion of Orthodox medicine. Because in our own case, and I don't know what science has to explain, a woman who had reached menopause became pregnant. You understand? So the last question, I'm just trying to compare notes. But the first three, I really want to know what is wrong.
Let me give you the typical example of somebody that has a problem that has been resolved and still the person does not get pregnant. Can you hear me? An example is fibroid. It's a very common disease that we see in our infertility clinic. Many women come with fibroid, we remove the fibroid, everything is clear, you do an ultrasound scan, there's no more fibroid, but still the person cannot get pregnant. It's possible. And from the investigations we've done, that was the reason why she was not getting pregnant, and we've removed it, and still she cannot get pregnant. The other thing is endometriosis. Endometriosis can affect the ovary, it can affect the womb, we'll call it adenomyosis. You can resolve it, do laparoscopic surgery, and still the woman will not get pregnant. The other one is PCOS, the one that causes women to have menstruation maybe once in 3 months, twice in a year, and all that. You try to solve it, give them these combined oral contraceptive pills to regulate the menses, but still at the end of the day, the women may still not get pregnant. So despite solving orthodox problems, as we said, the major factor in the fertility of a woman is her age. The best time for a woman to get pregnant is between the age of 18 and 25. 18 to 25, that's the best time. 25 to 30, still also okay. 30 to 35 is already going down, but by 35 and above, even if everything is okay, the chances of her getting pregnant reduces naturally by 35. Even if everything is perfectly okay, the husband is perfectly fine, her chances of getting pregnant spontaneously without any assistance is very low. So it's not just solving an orthodox problem alone that makes a woman to get pregnant. As we said, there are still 10 to 15% of them that we cannot explain why they cannot get pregnant. Sometimes once you solve the issue of like the fibroid, they can get pregnant. Immediately the next month, they get pregnant. You solve endometriosis, you solve PCOS, they get pregnant. But not everybody. Not everybody. For the second one, evacuation, yes, sometimes if evacuation is, a woman is pregnant and they remove it's like cleaning up the womb. They call it cleaning up the womb with syringe. We use syringe and some cannula to empty the womb. Previously, they used to use metallic instruments. We didn't like that because it's the one that causes scarring of the womb. But now we use syringe like it's rubber. But by the time you are doing evacuation and it's much more than the product that you are removing, you can actually remove the layer of the womb that that usually sheds every month during menstruation, and that's the place that the baby stays inside. So if you go and do vigorous evacuation, you have actually packed off that layer that sheds every month, so the woman will stop menstruating. Not likely, because even if she conceives, she's going to have a miscarriage, because the space where the baby stays is the same space that sheds every month during menstruation. That particular space is called the endometrial lining. So during evacuation, that's why I say you should be gentle, and you should use the size of the syringe that is appropriate to the how many weeks the pregnancy is, so that you not go and overdo it. Overdoing the evacuation is what packs all the layers in the womb that is responsible for shedding every month, that leads to. It's as if you have a wound and it's supposed to heal with very nice collagen and all that, but you went and packed all the collagen away from there. So it's only scar tissue that is fibrous, is now hard tissue that is there. That is what is remaining within the womb. So the space for her to, the hormonal balance that will give signal for the womb to shed every month, even if it is there, there's nothing to shed. So she'll stop menstruating. So it's over vigorous MVA that causes that, yes. Yes, a woman that does not menstruate can get pregnant.
Okay.
Yes, she can get pregnant. An example is a woman that's breastfeeding. There are so many women, when they are breastfeeding, they don't menstruate. And before they wean the particular child, they get pregnant again, even without seeing their menses. This can be explained by the fact that normally we have what we call lactational amenorrhea. A woman that, when she's breastfeeding, the hormone responsible for breastfeeding blocks the chances of her doing ovulation. But after 6 months, a woman that has that lactational amenorrhea, after 6 months is not a reliable method of family planning. So after 6 months, there's a chance that she may just have spontaneous ovulation somewhere. And then, even if she's not menstruating, she can get pregnant. We've seen cases like that. Then menopause, yes, it also can happen, but it's rare. For a woman that has already reached menopause as defined by 1 whole year, she has not been menstruating. That's how you define menopause. A woman that after 1 whole year, it was 24 years, 12 months complete, that she's not more menstruating.
51-year-old.
Yes, it's possible, because even at menopause, as I told you, the follicles become atretic. All the follicles that start growing every month, is only one that goes to ovulation and the remaining die. So even if a woman is menopausal, at least 1,000 follicles are still remaining within the ovaries. Sometimes there may be one that is viable, and it also depends on so many factors. One, if you see a woman that her family, they are very fertile. Very fertile people in their families. There are some people that immediately they are winning, they are getting pregnant, winning, they are getting pregnant. That kind of family. In such a woman, people that are 52, 53 can get pregnant. Because it runs in their gene that they are very fertile in their families. And even if they don't have such in their family, spontaneous ovulation can occur. Even within the menopausal period, it's possible for a woman that is menopausal to get pregnant.
If you have been attending to cases, you have plenty questions. You understand? And we need, because like I've always told you in class, that Orthodox medicine has gone far, including Orthodox pharmacy. They enjoy funding, research. Even Chinese medicine doesn't enjoy as much as what they enjoy. You understand? Ayurveda, the Indian medicine doesn't. How much more prophetic medicine? You understand? Look at champion. So it's better you come out and ask a lot of questions. There is a case I encountered. There is this sister I treated. So she had gone to hospital and everything. She had once been pregnant. One thing had led to the other. But my question is, I want to know the meaning. They told her that she is menstruating, but she's menstruating inside. That she's not menstruating outside. What does that mean? I don't understand it. That is that. Secondly, you also said one thing in your presentation. You said a man that had passed 45-year-old, his sperm will become weak. You understand? What's the meaning of this weakness of the sperm? Is it that he will not be able to impregnate, or the child that will, because A girl of 20-something-year-old I wanted to marry told me this. That's why she rejected me. And we have to settle this issue this year. So please come and resolve it here.
The first one you were saying, I've forgotten what you said.
Inside.
Yes, that's the endometriosis and adenomyosis I talked about.
Okay.
Yes, it's possible. Some women menstruate, and the menstruation, some of it goes backwards into the tubes. That's why so many times when we see ultrasound results, and because there's fluid, they'll say fluid in the pouch of Douglas, and there's somebody saying PID. It's not always PID. Because normal menstruation, as we said, it is the shedding of the endometrial lining. That womb is one that shed that comes out. But there are some that go backward into the tubes. You understand? So some of it, maybe in her own case, most of it goes backwards into the tubes and into the cavity, the pelvic cavity and all that. That is what they mean by she's menstruating and menstruating inside. So it's called endometriosis, adenomyosis. It can explain all that. Some of them will go backward and affect the ovary. Some can go backward and affect the other things within near the womb, the rectum and other things. So the menses has gone to that side. And it's because she has the endometrial tissue in those organs. That is why they also menstruate together with her at the time that she's having the normal menstruation. So it's possible. Just check endometriosis, adenomyosis. You will have more explanation of that. The quality of the sperm. You know, women have what we call menopause. For the men, we call it andropause. Okay. They also have a time that the quality of their sperm reduces. Okay. Yes. But one thing you need to know about fertility is that it is defined based on a couple. It's not based on an individual. A woman that has low fertility may marry a man that has very high sperm count and she'll get pregnant. A man that has low fertility and the woman has very high fertility, she'll balance it out. That's why you see some women, they'll tell you that they get pregnant but until after 5 years before another pregnancy. Then it will take another 5 years or 7 years, but she'll get pregnant. So either the man has low fertility or the woman has low fertility, but they have balanced themselves out. You understand? But the likelihood for you to have very good fertility is when you marry a younger person. When you marry a younger person, as I said, between the ages of 18 and 25, even if the man is 70 years old, and he marries between a lady that is between 18 and 25, she can get pregnant even the first month. Because that's the peak of her fertility. So but even if the man's own is going out, what I mean is that if, let's say, a man has sperm count of 100 million, every mil of semen that is emitted during ejaculation, the normal count should be between 20 to 100 million. But some people have up to 70, 80 million at the peak of their time. That's for the men. But by the time they reach 45, 50, that mil of sperm now, of semen, will have maybe like 30 million. Okay. Instead of the normal 70 million he had when he was younger.
30 active.
Yes.
30 million active.
Yes, that's what I'm saying, that the activeness of the sperm of the man goes on throughout his life. He still has good active sperm throughout his life. But the amount and the number will be reducing after. That's why if a 70-year-old marries an 18-year-old, she can still get pregnant, because that active one, although the number are few, but since the woman's fertility is high, it will balance out and she can get pregnant.
This kind of question, why did Allah not give Aisha a child? You know, my problem with that question is I don't have access to Lawil Mahfuz. So, I don't know the reason, and nobody knows the reason. Then number two, giving back, is it prosperity? If it is prosperity, all the wife of the prophet mentioned by Professor, they would have gotten children. It is not. You understand? In fact, what Quran called children, he said, number one, Quran says, is just, something worldly, material things. Another place he said is trial. That your children, your wealth, they are trials for you. But we beg that we should be blessed with children. If we don't have, that shouldn't get us depressed.
But part of the things that I've read is that there's a lot of hikmah in what Allah does. Remember all the male children of Rasulullah sallallahu alaihi wasallam died. Can you remember that? Can you imagine what would have happened if the prophet had a son that was still alive after his prophethood? People will start worshipping that child. Or they'll put them in a status that is not what Allah wanted them to be. So part of the hikmah from the little knowledge I have is to make sure that we don't have any confusion as to the fact that he is the last and final messenger. That's one of the things I would say. The premium that is put on childbearing is an African tradition. I had a friend that when she was in the UK, she had neighbors that in the house she went to look for, they said that, please don't bring children here, but you can bring cats and dogs. A couple in the UK can decide that they want to get married and they don't want to have children, and that stays. Nobody will even ask. It's not your business. I used to say that when a couple, sometimes it may be that the woman does not want to get pregnant, the man does not like children, but the family pressure is there that, your wife, how is her condition? Is she started vomiting? Both of them may have decided they don't want to get pregnant, and the woman is doing family planning. They are young, they want to enjoy themselves. I've seen couples recently, they don't want to get pregnant. The woman and the man said, please, he wants to do masters, she wants to do whatever. They are doing family planning and they are enjoying themselves, they are married. But their family are asking, it's 2 years now, it's 3 years, what's your business? You understand? And it's we women that actually are the problems of women. We are the ones that put pressure on our sister-in-laws and our daughters. Or our daughters-in-law. Sometimes it is the decision of the couple to have that voluntary infertility. They don't want to get pregnant at that time. You understand? So please, we need to be very careful. And sometimes it is actually that you have a problem. So you understand? So you need to categorize it. It's an African tradition that has placed so much premium on childbearing, and it's family pressure, societal pressure that says that if you don't have children, you don't have wealth. It is not true. It is not true. It's African tradition. If you go to UK, US, and you spend 20, 50 years, you've not seen somebody that died and all the wealth, they should give it to a cat. Yes. Or put it in a trust or something. So it's an African tradition that puts so much premium on childbearing. For the question of menopause, that's what we call premature ovarian failure. Premature ovarian failure means a woman stops menstruating before the age of 40 years. A woman may be 20, maybe 35, and then she stops menstruating. That means we know that her ovarian function is no more there, and she has reached menopause. Because, as we defined earlier, any woman that does not menstruate consistently for 12 months, she has entered menopause. We have seen those that are younger than 35, younger than 40, that happens to. But the normal age for menopause in our own setting, Africa, Nigeria, is between 45 to 55. And it also depends on your family heritage again. It's now